This is the device that would make you legal in Ohio to smoke flower.
U.S. veteran Paul Lubell says he used to vape THC, but now he uses this device to consume marijuana a different way. Lubell stopped vaping because he was one of the thousands of people across the U.S. who became seriously ill after vaping THC. But this 59-year-old Cleveland area resident doesn't fit the profile of most of the people who've contracted vaping-related lung injury. Most are young, under the age of 35. But some older people like Lubell are using e-cigarette devices in search of pain relief.
You're seeing me at a good day. Yesterday, I was a wreck. I was not able to function the entire day.
Lubell says he's not sure when his problems started, but he wonders if it's related to his days on a Navy helicopter rescue team. Do you miss those days?
I do. It was fun. Had a great time. I was good at what I did, so everybody wanted me.
Lubell says in trainings and offshore rescues, he sometimes jumped off the helicopter smacking into the water. That could have been the genesis of some of his back pain. He's had 2 back surgeries and suffers from serious neck pain. Lubell says he's tried many medications looking for relief, including opioids like hydrocodone, but that's not an option now.
So this is my battery of pills that I take. The VA is not a friend of opioids at all. Not unless you're coming out of the hospital for surgery or something like that. They do not give vets opioids.
After he couldn't get opioids, Lubell says he was in a tough situation, having to decide how to deal with his pain. He started using an e-cigarette device with pre-filled THC cartridges that he got from a friend.
And when I say it took away pain, it was almost instantaneous. It made me capable of doing my daily activities. It made me capable of doing other things normally.
When people vape, they attach a small cartridge that's filled with THC on top of an e-cigarette device. When they inhale, it pulls the THC and other liquids in the cartridge over a heating element. When they exhale, it creates a cloud in the air, which is different from smoking marijuana other ways.
It doesn't have a stench to it. You could do it out on the streets. Again, it doesn't have that what's the word I'm looking for, stigma.
But in July, a few months after he started vaping with the THC cartridges, Lubell ended up at Cleveland's Veterans Hospital Emergency Department.
He had this cough that was persistent. He just looked very, very sick.
That's Dr. Amy Heiss, who was on the team of physicians that treated Lubell at the VA.
He was put on very strong, broad-spectrum antibiotics, and yet he continued to have fevers. He continued to feel unwell. He had very flu-like symptoms.
Lubell seemed to improve and was released, but then he grew ill again in late August. Dr. Heiss says she was surprised when he came back to the emergency department. By then, however, she had seen a newly released alert from the Centers for Disease Control and Prevention about the vaping illness. Lubell had also seen reports in the media about this quickly spreading problem related to vaping.
He was forthright that he had been vaping, and indeed what had happened is when he was in the hospital before he'd stopped vaping, he stopped for a period of time until he started to feel better, and then he started it up again, and that's when his lung disease came back.
Lubell says even though vaping eased his pain, those 2 bouts of sickness were too much. He won't vape again. Dr. Heiss agrees with that decision.
I think there's just too much that's not known about what's in these products to safely use them.
But Lubell is not alone in turning to marijuana for pain management. Medical marijuana is legal in Ohio for chronic pain, says Dr. Melinda Lawrence, pain management specialist at University Hospitals. Many patients are telling her they're trying it.
This is one of the most common questions that we get in clinic. I mean, people ask us every day about this, and so I think patients are really aware of it. But I think in terms of from a medical standpoint, we don't have those specific data. So I think there's a lot of unknown in terms of marijuana and how it can play with chronic pain.
Even though some patients say it works for them, there's not enough research to prove it's broadly effective, she says. Lubell, who has a medical marijuana card, is still planning to use marijuana, but he won't vape. He gave his equipment and THC packets to health officials for analysis. As federal officials continue to search for the specific cause of the vaping lung illness, they strongly recommend that people don't use e-cigarettes or vaping products that contain THC.